Hello, my name is Grzegorz Krzyżniowski and I'll be performing the history and physical exam for newborn Johnny laying here on the examination table. I'm going to zoom in closer as I perform the history and physical. Okay, we have Johnny over here. Johnny belongs to his 25-year-old mother, Jennifer, who had access to prenatal care. She regularly visited her OBGYN for all her routine prenatal care appointments. Jennifer had a normal weight with a BMI of 22 before her pregnancy. She gained about 30 pounds during her pregnancy. Her general health is well, with no personal history of chronic disease, nor gestational diabetes or thyroid disease. No history of drug or alcohol use during pregnancy, nor maternal smoking. No reported partner violence. No history of maternal depression or anxiety disorder. Jennifer is up to date with all her immunizations, and this is her first child. As far as her birth history for Jennifer includes a vaginal birth with no assisted devices and cephalic presentation. No history of premature membrane rupture or maternal intrapartum fever. Jennifer had a negative maternal group B streptococcal screen. Johnny did not present with any respiratory distress at birth, with APGAR scores of 8 at 1 minute and 10 at 5 minutes. Now, as far as his feeding history, stooling, and urination, Johnny has been exclusively breastfed since birth by Jennifer. He is fed 8 times every 24 hours and has about 6 to 8 wet diapers per day. Johnny was born a term infant at 38 weeks. He was born weighing 7.5 pounds or 3.4 kilograms and had a length of 50 centimeters and 34 centimeter head circumference. And the measurement would be performed for measuring head circumference would be measured by above the brow, around the occiput of the head, and back to the point of the tape measure. The length of Johnny would be measured from the crown of his head all the way to the heel of his foot. Physical exams performed in a well-lit room while the infant is calm, with warm hands and warmed equipment. Johnny, at the moment, as you can see, he is awake and quietly in an alert state. The neurological part of the exam is performed throughout the physical exam. Before touching Johnny, while he is dressed on the exam table, perform a general inspection, determination of gender, identification of any deformities, determination of fetal nutrition, assessment of color, and position of movement. His color appears to be appropriate for his ethnicity. He is pink. He is moving at the moment. The parts of the exam that are performed first are the quiet parts of the exam, which include the cardiac and respiratory parts of the exam. The heart sounds are performed at the same 4 places, however, better with a pediatric stethoscope. You would normally Johnny here, S1 and S2, with a heart rate of between 110 to 160 for the infant. And normal respiratory rate for the infant for the newborn would be between 40 and 60 breaths per minute. Johnny's current vital signs are a temperature of 37.0 degrees, axillary thermometer held at the base of the axilla for 3 to 5 minutes. His respiratory rate is 40 breaths per minute, heart rate is 130 beats per minute, and blood pressure is 70 systolic over 45 diastolic. The skin on his body is assessed and inspected, his entire surface, through inspection and palpation. Palpation for skin thickness and turgor. Assess the skin fold. Skin pigmentation is appropriate for his ethnicity, and he is pink. The skin color is assessed. The mucous membranes of the tongue are the mucous membranes and the tongue are the most reliable color indicators in the newborn. There's no acrocyanosis or central cyanosis. Mild rash is noted on Johnny. The common rash of erythema toxicum with small yellowish white papular lesions with erythematous base on the face and the trunk. There's no interventions needed because it disappears spontaneously. The head is then inspected. It's assessed for size, shape, presence of abnormal hair patterns, scalp defects, unusual lesions, lacerations, and any abrasions or contusions during the delivery process. Johnny here doesn't appear to have any cephalohematoma or succedaneum, caput succedaneum. His head is normal cephalic. There's no cranial molding or subgleal hemorrhage noted. To palpate the fontanelles. Fontanelles are evaluated for size and shape and fullness. The diamond shape of the anterior fontanelle closes by 18 months of age. I could still feel it here. And then the posterior fontanelle is triangular shaped and it closes by 4 months of age. Hair is assessed for distribution, texture, and presence of any whorls or hypopigmentation. The face is then inspected for symmetry, gross presence of any anomalies or deformities, and symmetrical movements during different behavioral states. The eyes are inspected. The eye assessment is performed via inspection, palpation, and selected use of the ophthalmoscope. The eye spacing is noted to be normal, and intracanthal distance between the eyes also appears to be normal. Assess the eyes for any slanting. There doesn't appear to be any slanting on Johnny. The newborn's iris color varies from brown to dark blue. Johnny's are brown at the moment, and they don't form their permanent iris color until 6 months of age. Pupil reactivity is performed with a pen light, with pupils being equal in size and reactivity to light. Red light reflex is present. For the ears are assessed via inspection and palpation. The top of the pinna should be in alignment with the intracanthal, the height of the intracanthal point at the eyes. Pinna should recoil when folded down. The ears are assessed for positioning, presence of deformities, swelling, any bruising, pits, dimples, and tags. The external auditory canals are grossly inspected for patency. Hearing acuity is determined by automated auditory brainstem response, or ABR. The nose is inspected grossly for patency and symmetry by placing a thin cotton swab over the nares while the other nair is occluded, and looking for rhythmic movement of the wisp as the infant breathes through the nose. The mouth is then inspected. The mouth, the lips, the gums, and the palate are inspected and palpated for any deformities such as cleft palate. The uvula is also inspected. The sublingual frenulum should be inspected when the infant cries to determine the position of attachment to ensure there is no ankle glossia or tongue-tied. Okay, the neck is then inspected and palpated to determine suppleness, symmetry, range of motion, and to detect any extraneous tissue. To inspect for cysts, defects, dimples, masses, any redundant skin. The neck is manipulated side to side and assessed for range of motion. The chest is inspected and palpated for size, shape, symmetry, and contour. Symmetrical movement with respiratory effort, noting any inspect and palpate the clavicles to determine any trauma from delivery, any tenderness or crepitus. Inspect for the presence of any supernumerary nipples. The lungs and the heart were already auscultated during the quiet portion of the exam. Palpate the pulses, the brachial pulses of Johnny, the radial pulses, and the femoral pulses, and also compare them to strength. Compare the strength of the upper and lower pulses and the dorsalis pedis as well. Perfusion is assessed by blanching the skin on the chest and allowing for the return of color. The color blanches here back to pink. The abdomen is expected for contour. Johnny has a rounded abdomen, and it's palpated for normal presence of internal organs and any abnormal presence of masses. His abdomen is noted to be soft. Light and deep palpation are performed in circular, examining the 4 regions. The umbilicus. The umbilicus is inspected for color and state of healing and any presence of vessels. The liver is palpated in the upper right to midline region. The spleen is palpated but not felt in the normal exam. The kidneys are palpated using bimanual technique with deep palpation at a 45-degree angle just below and lateral to the umbilicus. Genital and rectal exam. The perianal region is assessed for presence of a patent anus. Newborn passes their first stool or meconium in the first 48 hours. The femoral area is inspected and palpated for any bruising and swelling of the genitals. The penis is inspected for Johnny, and the urinary meatus is normally placed at the ventral tip of the penis. The scrotum is inspected and rugae of the scrotum for color and symmetry of the scrotal sac. Testes are palpated bilaterally for size, firmness, and tenderness. No hydrocele is noted on Johnny. the musculoskeletal extremities and spine. He's in a normal resting position of a term newborn. The normal resting position of a term newborn is inward flexion of upper and lower extremities, as such, with fists closed. The extremities are assessed for size, shape, range of motion, alignment and symmetry of movement, and presence in number of digits. All of Johnny's digits are present. His range of motion appears to be all within normal limits. The skin underlying the spine is inspected for lesions, any pits, tags, or hair tufts which may indicate congenital malformations. The hips are assessed for stability by performing the Barlow and Ortolani maneuvers, and they're assessed for developmental dysplasia of the hips. Barlow maneuver dislocates the hip by adducting the hips and applying posterior force to force the femoral head over the posterior rim of the acetabulum. And the Ortolani maneuver reduces the dislocated hip by abducting the hips, and the femoral head slips back into the acetabulum, and there's an audible click and palpation felt. And there doesn't appear to be an audible click here for Johnny, and his hips are normal. The neurological system is assessed throughout the exam. The muscle tone is assessed. Ethnic variations of muscle tone, such as increased tone with African American newborns. Johnny's tone appears to be normal. No hypotonia noted. Most primitive reflexes are tested, such as the Moro reflex, and noting symmetrical movements of his extremities while doing so. That rooting reflex and the sucking reflex are also performed. Inspect the mouth and the lip for any cleft palate as before, and both reflexes are present. The stepping reflex can also be examined with the newborn by them replicating walking. And the reflexes disappear usually by 3 to 4 months. The plan of care for the newborn to tell the family is to continue the regularly scheduled follow-up appointments, to continue for the mother to continue her prenatal vitamins with iron, to avoid alcohol, to avoid exposure to any secondhand smoke. The plan of care may include supplemental feeding depending on the weight gain of Johnny as he progresses in his new life. Anticipatory guidance. The first priority is to always acknowledge any concerns of the parents, to encourage the mother to accept any help from family and friends so she can recover from her delivery and focus on the baby, to remind the mother to spend time with any other children she may have, to learn about the baby's temperament and reactions to better respond to Johnny's needs as he's growing, to establish and maintain routines. Physical contact and talking helps Johnny feel secure and for him to learn. It's important to use fragrance-free lotions and soaps to avoid any powders, to avoid direct sunlight. Changes diapers frequently to protect from any diaper rash, which seems to be fine at the moment. The care for the cord is important as well. It includes air drying by keeping the diapers below the navel, It's important to tell the family that if they smell any odors, see any redness around the cord during this newborn time, to call the provider. It's important to let the family know to avoid others with colds and flus. Immunizations due during the newborn period include the hepatitis first dose of the 3-dose vaccine series, and the newborn also receives the vitamin K intramuscular injection to help with coagulation. And that completes the newborn history and physical exam assessment.